It's somewhat ironic that we're talking about the expansion of services to our nation's veterans at a time where some herald the introduction of a bill that in all likelihood will deprive other Americans of the ability to have affordable health care. We've gone through several months of debate now about health care being accessible and affordable for all Americans. We've talked about reforms. Let's change the system. Let's reform the system. Let's make sure that access and affordability, let's bend the cost curve down. And in the last 24 hours, some have come and said, we've accomplished that. It's amazing. Now, let me remind my colleagues, we've all said that health care is unsustainable at its current level of investment, 17% of our gross domestic product. I find it somewhat odd that we would start the debate, given that it's unsustainable at its current financial investment, with how much more money does it cost to reform health care? I mean, the obvious answer to me is it should cost zero if you're already spending too much, so we should look at the reforms before we look at the coverage expansion. Now, I agree that every American ought to be covered. As a matter of fact, Dr. Coburn and I have offered comprehensive bills to do that. But it's matched with real reform. What was heralded in the last 24 hours was, in fact, a $2.5 trillion health care bill. $2.5 trillion over a 10-year period of collecting the revenues and paying out the expenses. You see, this is where gimmicks, smoke and mirrors, whatever you want to call it, are used in Washington. If you collect revenue for 10 years, but you only pay benefits for 6 years, you don't get a true picture as to what it's going to cost over 10 years. You get a true impact of the revenue stream, which is over $800 billion. Where does that $800 billion in new revenue appear from? Well, taxes. They go up $493.6 billion. $93.6 billion. Medicare. We will cut $464.6 billion out of Medicare. $500 billion we're going to take from a program with a designated population of beneficiaries of our nation's seniors and those who are classified as disabled. And we're going to take $500 billion from Medicare and we're going to shift it over to meet the new burden of a health care plan yet to be constructed. Why is this problematic? It's $1,063 per Medicare beneficiary every year. Over the 10-year cycle of this health care plan, we're going to steal from every senior in this country $10,363 worth of health care money. We're going to take it from their program and we're going to put it over in this new program because it's paid for. Now, legitimately, when you raise taxes, when you raise fees, when you raise revenue, you're making tough choices. And I think when you go in and you tax health plans and that raises $149.1 billion, when you increase a penalty for a non-qualified health savings account and you get $1.3 billion, these are revenues. They're legitimate. It's no smoke and mirrors. I don't think the American people believe for a minute that this is deficit neutral. I don't believe for a minute that they believe that we're going to take $464 billion out of Medicare. And if they do believe it, they know we're going to pay it back in with future taxes on the American people. That's fine if that's the way we want to prioritize. But health care reform affects every American. This is a very personal issue for every American and every family. It touches them unlike anything else we do. And the truth is, they know that if you take it and you put it in one pocket and you take it out of the other pocket, the effects on them either haven't changed or it's been negative. Now, let me suggest to my colleagues that this bill is 2,074 pages. I will admit, I may be the only one. I have not read it since it was introduced at 6 o'clock last night. I'm not sure that there are many members that have or could have. But let me suggest to you that there will be a question about whether for the first time we use taxpayer money to perform abortions. Personally, I believe that that's wrong. I will not support a piece of legislation that does that. This bill does that. An employer mandate at a time where American companies are trying to be competitive in a global marketplace. We raised $28 billion in employer mandates. Well, I'm not sure that that's making U.S. companies more competitive in a global marketplace. I think the economy is the number one challenge that we've got in America. I think 10.2% unemployment and going up. If it were a disease, we would be on the floor of the Senate calling it an epidemic, and we would be doing whatever and spending whatever to turn it around, but we're doing nothing. As a matter of fact, we're doing everything we can to try to drive unemployment up, to dry up the economy, and to make companies less competitive in a global market. The president said the objective, or one of the objectives of healthcare reform, was we need to bend the cost curve down. We need to make sure that there's cost savings in healthcare for every American. Well, let me tell you what the Congressional Budget Office says, and I quote, "Under the legislation, federal outlays for healthcare will increase during the 2010-2019 period, as would the federal budgetary commitment to healthcare." Now, that's Washington language for, you know what? Our expenditures on healthcare are going to go up, and what happens when federal expenditures go up? Everybody's go up. I mean, that's a known fact by the American people. The coverage expansion would drive a new increase in government spending on health to the tune of $160 billion over 10 years. Make no mistake, this does not bend the curve down, it bends the curve up. We spend more money. CBO scored the bill as reducing the deficit by $130 billion over 10 years, 2010-2019. Now, what does it take into account to come to that calculation? It assumes that doctors are going to get cut 23% in their reimbursements in 2011. We have less than 1 million doctors to serve 300 million people. And does anybody believe for a minute that we're going to allow a 23% cut to go in at a time that we are starved trying to attract people to go into medicine as a profession? If it does go in, we're going to take $247 billion out of the pockets of doctors that we rely on to perform the surgeries, to make the diagnosis for us and everybody else in this country. The new creation of the Class Act, long-term care policy, shows in the CBO score $72 billion savings. Well, let me sort of explain to you like this. Nobody qualifies today because it doesn't exist. People are going to pay premiums to be eligible for this long-term benefit. It takes about 20 years of paying in before somebody's going to be eligible to pull out. It's not like Medicare when we created it, where even if you never paid in, you started on day one. So we're collecting revenues for 20 years before we ever pay out the first dime. It's not hard to understand why you'd have a $72 billion surplus out of this. But let me ask you, what happens after that? What happens after you get past that 20-year number? Well, truth is, it starts to get into the trillions and trillions and trillions of dollars that the federal government is obligated to based upon the premiums and the benefits that people have assigned to that they pay out. Well, if you eliminated these two gimmicks just on the face, this bill would be $189 billion out of balance, in the red. It would not be paid for. And I would suggest that that's just two smoke and mirror tools. The start date was moved to from 2013 to 2014. No longer is our focus on how do we get care delivered as quickly and as efficiently. We just pushed it off a year because we said, geez, the Congressional Budget Office says we're short on raising money, and we've raised all we can in fees and taxes. Well, maybe not all. I think they probably got some things targeted that are still yet to come out. Key thing is, even if you did implement it, there are 24 million Americans that are still without insurance. The objective to cover everybody was not met. There's $25 billion worth of unfunded mandates to our states. I don't know of a state that's in financial health today. There may be one or two. My state of North Carolina was $4 billion out of balance last year. The federal stimulus was $2 billion of closing the gap. That $2 billion, by the way, we didn't have. We borrowed to give to North Carolina and other states to create jobs. And it was used to close budget gaps, so they didn't have to make tough decisions. As a matter of fact, we found out this week on one of the news channels there's $98 billion that didn't have anything to do with stimulus. I mean, we're the laughingstock of the world on the way we applied the stimulus package. But the sad part is not the fact that it's been uncovered. It's that it didn't do anything to put Americans to work. And now we're saying to the states, we're going to put another $25 billion on you. Well, in Medicare, we're going to cut from the fee-for-service payments $192 billion. So we've already got $247 billion over here that we're getting from doctors if we go through with the payment cuts. Now we're targeting another $192 just out of the Medicare reimbursements, right out of the pockets of doctors and hospitals. Is there a community hospital in America that will be able to survive, given the cuts that are getting ready to hit them? We cut Medicare Advantage, $118 billion. Some cheer that. I tell you who doesn't cheer it, the 20% of America's seniors that chose Medicare Advantage as their preferred choice to traditional Medicare because it required them less out-of-pocket obligation. It didn't hit them for $750 deductible the day they walked into a hospital. What about those 20% of our nation's seniors when they lose Medicare Advantage? What about the $43 billion in disproportionate share payments? We pay it to hospitals to make up for the uncompensated care that they deliver. Well, I guess the authors of the bill would say, well, we're covering everybody, so there's no uncompensated care. Wrong. 24 million still without insurance. There is going to be uncompensated care, and we're taking away the money that we provided the hospitals to make up for the uncompensated care that they delivered, meaning it's coming right out of their hide. That local hospital in the community we live in. $23 billion in unspecified cuts by the Medicare Advisory Board. I mean, does America really feel comfortable with us turning over to another advisory board to cut $23 billion? We just had an advisory board say, you know, if you're 40 to 50 and you're female, you really don't need to worry about your breast. You don't need to go get a mammogram. You don't need to do self-examinations. Trust us. Mr. President, one of the reasons that the healthcare system in America is the best in the world is because we spend money to innovate. We hope that companies find breakthroughs. We look at diagnostic abilities in an effort to try to detect early so that the options are greater and so the cost is less. But now all of a sudden we're saying that's not important. Mr. President, there are 162 million Americans who currently have employer-based health care. In this bill, regardless of what their employer does, they won't be eligible for a subsidy. If they've currently got coverage, but they may be low income, and for some reason their employer has to drop their health care or cut back on the plan because maybe they're not competitive after this in the global marketplace, even though they would qualify from an income standpoint, they will not qualify because they were provided health care before. And our favorite, the IRS says it'll take another $5 to $10 billion so that they can actually go out and collect these fees and taxes. Mr. President, the cost of the subsidies alone in the exchange are estimated by CBO to grow at 8% a year. Now, I just ask you, if the reason that we've gotten into this discussion, had this debate, was we're trying to turn the cost curve down on health care, and we've quoted 6% increase a year and 5.5% increase a year, 7% increase in a year, why in the world Would we be considering a plan that CBO tells us is going to have a cost increase for the subsidy of 8% a year? I would hope that if we had real reforms that worked, the cost of the subsidy would decline 8% a year. Mr. President, I know that there are others seeking time, and I won't belabor this point. I would ask members support the Coburn Amendment on the Veterans Bill, support passage of the Veterans Bill, read the health care bill, be prepared to debate the health care bill for a very, very long time, and be prepared to stand up for the American people on what's right. I yield the floor.